Good afternoon, Ms. Lerma. I'm Dr. Davila, and I will be your physician today. Can you state your name and date of birth for me, please?
My name is Alondra Lerma, and my date of birth is April 14th, 1980.
Okay, perfect. Thank you for showing up. How have you been?
It's been alright. I've been quite busy taking care of my 3 kids. You know how energetic they can be, and sometimes I can't keep up with them. But I wouldn't have any other way. How about yours?
It's going well. Thank you for asking. Let's go ahead and take a seat and discuss your results, okay?
Okay, perfect.
Okay, well, from what I reviewed in your most recent chart is that you were admitted a couple of days ago because you presented with chills and a very high fever. You also seemed very weak, and your husband noticed some loss of weight across the past few days. Is this correct?
Yes, that's right. Dr. Lopez had some blood work done and advised to come back today to discuss my results.
Okay. That's correct. Did Dr. Lopez discuss what a complete blood count is, or did he go into detail about like what it can indicate?
No, he didn't.
Okay, well, basically a complete blood count, we get a blood sample, and it basically kind of runs a long analysis of the, and it can indicate like different infections and other diseases of the immune system. I also read up that Dr. Lopez ordered further blood sampling and performed a bone marrow test. Is this correct?
Yes, when I was checked in, Dr. Lopez ordered some blood sampling and he performed a physical examination. He mentioned in my initial encounter that it could just be the seasonal flu, but the next day he explained to me that there will be some abnormalities with my white blood cell count, I believe. And he decided to do a bone marrow test to get a definite answer.
Okay, that's right. So there are various reasons why your health might have changed in the past few days. I know he mentioned the seasonal flu, and we did see some abnormalities in your white blood cell count. And the bone marrow test was performed because we wanted to check the fluid and tissue in your bone marrow, all right? So will you be okay in discussing the results of your investigation with me today?
Of course, doctor. Thank you.
All right. Before we move on to discussing any results, would you like to have someone in with you today in the office while we're discussing that?
Yes, my husband. He's outside in the waiting room.
Okay, perfect. Let's go ahead and let him in. Okay, hello, Mr. Lerma. Thank you for joining us. Ms. Lerma, so how much do you want to know about your diagnosis? Do you want me to give you more or less of what the basis is, or a little bit more of like a broad overview? You go ahead and let me know.
I would like to know what the blood work and bone marrow indicated and the next plan of action for the diagnosis.
Okay, well, I'm afraid I will not be delivering good news for you today. Your results did indicate that you do have acute lymphoblastic leukemia. I know this may come as a shock to you, and I'm sorry, Mrs. Lerma, for this terrible news.
Okay, and what exactly is the type of leukemia?
It is a type of cancer. The acute lymphoblastic leukemia is a type of cancer that affects the bone marrow and the blood cells. The bone marrow is basically that spongy structure that is in your bone, and that's where the blood cells are created.
Okay, thank you for explaining. Now, how long do I have?
From your current state and treatment available, we approximate about 5 years.
Okay, and what do these treatments include?
These treatments, they will most likely include the use of chemotherapy, along with some other supportive care treatment, such as medication or antibiotics, most likely. We will need to get, of course, a few further test investigations to determine the right course of treatment. Okay.
How will the chemotherapy affect my daily life?
Okay, well, I know you are a working parent to support your children along with your husband. And I know that this decision may come as a hardship to you, but I think you should try to arrange things at your workplace for a permanent leave. This must be hard, but as you are aware, chemotherapy does take a big toll on you physically. You may find yourself unable to do certain actions, and it is important for you to have someone by your side to take care of you when you need help in doing those things. Okay.
What should I expect for myself in going on with this illness?
Going on with this illness, you may experience some weakness and loss of appetite during your treatment. Other side effects will also include possible loss of hair, and as well as the skin and nail discoloration. So you will see some physical changes in you, okay? And you shouldn't be afraid of that. It's totally normal, and it's the course of this illness, okay?
Okay, thank you for explanation. I would like to ask, how will we communicate with each other during the period? Will it be through email or through phone?
So we can have constant communication. I know the hospital provides a patient portal for patient-physician communication. So this portal is basically a mobile app which you can download, and you can create a personal account. In the portal app, you're gonna have access to your medications, to your and the status of your current illness. With medications, I know it also provides you the time when you're supposed to take those medications and how you're supposed to take them. Anything else?
Okay, thank you for the information. I'll download it as soon as I get home and make sure I create a personal account.
Of course, Ms. Lima. And I want to ask, how are you feeling right now? What's going on? What's going through your mind?
Well, we were expecting the most, and unfortunately, we did get the worst. I'm in disbelief and, to be honest, in great shock. I am worried for my family, and not to mention the payment details.
I understand. Again, I'm sorry, Mrs. Lima, about this terrible news. And I completely understand your financial worries. We do have a health insurance specialist in place for the patients, so they're able to go ahead and guide you with your worry as to how to pay for the treatment. So I know in your chart it says here that you have a health maintenance organization plan. So basically, Dr. Lopez is your primary care physician. He's going to go ahead and refer to you to an oncologist, which is a cancer specialist physician, who is going to discuss more in detail about the type of treatment you can undertake, all right, with your specific leukemia that you have, okay?
Okay, thank you for letting me know about the insurance specialist. And when will I be visiting the cancer specialist?
The cancer specialist, I believe the medical assistants, they're gonna go ahead and help you with that. They're gonna go ahead and set up an appointment. They're gonna give you a call most likely tomorrow, so keep an eye out for that call. It'll have the details of the appointment location, date, time, who you're gonna be looking, and they will also have a printed copy of the appointment reminder. So whenever you have time, you can come back and pick that up, just so you won't forget or anything like that. All right. Are there any other questions that you have for me at the moment?
Not now. Thank you, doctor, for your explanation and clear walkthrough of my diagnosis.
Okay, of course, Mrs. Lema. I do want to mention that we do have support groups in place. I know that these news must be hard for you, for your family, so there is support groups that we have who include patients with leukemia as well as their family members, who they share their experience with others, and maybe you're interested in looking at that and learning how to cope with this illness. Okay, we do have a flyer stand outside of the room, so when you walk out, feel free to take one of them. Okay.
Thank you, Dr. Dalla. I appreciate your concern.
Of course, Mrs. Lema. just to remind you, we will need to do some further testing, and treatment options will be discussed in your visit with your oncologist. I do recommend for you to jot down any questions you might not have now, but later on if they pop up, just go ahead and jot them down, and you can go ahead and ask them to your oncologist. Okay? All right, thank you.